Beginning, I want to thank you all for coming. This is a magnificent demonstration of the interest in this type of information, and it's a demonstration also of the concerns and issues of Vietnam veterans and their families. This event was coordinated by Tim Najadlik and the Upper Pioneer Valley Veterans Center, working in concert with so many other groups, and we want to thank them. I'm not going to name them now. You've seen most of them. Working with the Veterans Administration Vision One group out of Worcester and Northampton. We appreciate their contributions. The contributions of the local groups in Greenfield who have partnered with this project. And certainly we want to thank President Bob Pura for opening up this fine space for us at no charge and to accommodate the veteran community, working closely with their Veterans Office, Chris Demers, and GCC. So thank you, Mr. President. In addition, I'd like to say that this is such an old issue, but there's such new information. It's imperative upon us to try to get that information out to as many people as possible. Tim is going to open up the symposium almost. I call it a symposium because in 1983 we had a similar type of event in South Deerfield at what at that time was a Ramada Inn. Charles Figley, one of the leaders in researching and providing treatment options for stress, was there, along with a couple of doctors from Boston University. And we also had Dr. Tung, a North Vietnamese researcher, his report on study of dioxin contamination with the NVA, which had no exposure, and the South Vietnamese VC or NVA in the South. And that study, a longitudinal study at the time, produced some, you might say, horrifying information, but some statistics along the lines that made certainly Vietnam veterans cognizant of what the potential for exposure to the many different chemicals that were in Vietnam. From that moment, and the guest speaker at that time in 1983 was a lieutenant governor named John Kerry, and we had a great turnout and great discussions, and hopefully VVA will continue to do their part as they have done since that early time. We're back to the future again, and my last comment before I bring Tim Najadlik up is to thank you all who have served, and thank your families for the sacrifice. It's such a cliche to say welcome back, but really it's really great to be here with you. Thank you. Yeah.
We have here today to do claims, to set up an appointment with you, people from the VFW claims office, people from my office are here to do claims, people from Gumersindo's office under the umbrella of the VVA are here to do claims. So you can set up appointments with them and they can help you with any claims that might arise out of the issues that we'll discuss today. So if you'll join me for a short invocation given by Jen Mosier from Franklin and Hospice County, and then we can get going. Jen?
This is from Navy chaplain and Vietnam veteran Arnold Rezanoff. Spirit of life, whom we call by many names in thanksgiving and in anguish, let us remember all the lives of our Vietnam veterans. Some 2,500 years ago, the prophet Jeremiah cried out the words filled with pain and anguish, words of despair, words which might have come out of the mouths of our Vietnam veterans struggling to reclaim their lives. Why have they been smitten, he asked. And then for us, was there no healing? We looked for peace, but we could find none. We looked for a time of healing, and behold, we found terror. Help us ease the terror and pain of all who suffer because of war. And help us, all of us present here, to help them find their way to peace. Let our time together this afternoon remind us that while we come together to mourn our dead, we are here to reach out to all of you today, all of you exposed to Agent Orange. It is when we remember and honor our brave soldiers that we have the vision to dream our dreams again, that we have the faith to pray our prayers again. Today, may we have the courage to listen and learn from each other together. We honor all of our Vietnam veterans, their families, their spouses, their children who support them. And of course, we honor all the men and women in uniform today, tomorrow, and their families too. But most of all, we pray that we honor always our nation, its values, its freedoms, and its dreams. And to this may we say, Amen.
Thank you, Jen. She won't tell you, but her ex-husband passed from Agent Orange. He was a Special Forces captain, served multiple tours in Vietnam. So that's why we're close to Jen. Mayor Martin again.
Again, you know how those politicians are. That was a joke. I want to first say that it's wonderful to have the Secretary of Massachusetts Department of Veteran Affairs, Francisco Urena, here with us, and also the lead point man for the Vietnam Veterans of America, Legislative Director Rick Weidman. Both these individuals bring history, knowledge, motivation, dedication to veterans. And Secretary Urena, Marine vet, Purple Heart, has been in the trenches, so to speak, working as a veteran service officer, and now leads the entire veteran service Chapter 115 program in Massachusetts. We are fortunate to have him here, but we're more fortunate to have him in the position he holds as an appointee of Governor Baker. So, Secretary.
Mr. Mayor, thank you. Thank you very much. Thank you. What a great afternoon to be here in Greenfield. What a great facility this is at Greenfield Community College, and what a great privilege it is to be in front of all of our Vietnam veterans that have showed up here and their families. And so in that spirit of welcoming, I know many of you all received your welcome home pin this morning. I want you all to always wear this with honor and pride as a symbol of our appreciation, collectively, of your service to our country. It was our Vietnam veterans who, in 1991, at the turn of the Gulf War, said, never again will we welcome the next generation of veterans the way you all weren't welcomed. And so to that, my generation, the Iraq and Afghanistan veterans, thank you all for your commitment, your sacrifice, and the aspect of your ability to say never again. And so let us all give our Vietnam veterans a great round of applause for their service and sacrifice. And it is always a good opportunity to say welcome home. On behalf of our Governor Charlie Baker, Lieutenant Governor Polito, 365,000 veterans who call Massachusetts home, I truly am honored to lead the Department of Veteran Services, working alongside of our veteran service officers, many who are here today, but I really want to thank Tim for his leadership, not only in organizing and coordinating this great event with so many partners in and around this room, but also what he does for the town of Greenfield and the district, ensuring that veterans and families do not go without getting the services and the safety net that is provided. So I want to give Tim a great round of applause and let us recognize him for what he does. And today we have the ability to walk out of this room empowered, knowing what's available for not only our Vietnam veterans, but knowing what's available for the community. And essentially, each and every one of you all are going to be the voice, not only for Tim, but for our department and for everything that happens in and across the western part of the state. It is a very special part. I want to recognize Superintendent Bennett Walsh, who today is also acting as photographer, but I want to recognize him while he's up here. Superintendent Walsh is the superintendent of the Holyoke Soldiers Home, a very special institution and a very aspect of what makes Western Mass a special part of our veterans community, providing long-term care for our veterans, providing the aspect of community, and providing a great option for volunteering for many veterans and members of this great community. I want to recognize the veterans and also the leadership of the VA, who's a great institution here in the western part as Central and Western Mass VA, and thank you for the great commitment. In that aspect of VA, I know there are many proud veterans in the audience who probably have ever thought about walking into the VA. And let me tell you, I go to the VA because I believe in what they do. I go to the VA because I know that it is a great aspect of research that happens there, but it is a place that cares about our veterans. And so do not miss another opportunity today to sign up for VA healthcare, because it is truly a great benefit that you have earned because of your service to our country. Let me thank you all once again. Let me thank each and every family member that's here, because whether you were drafted or you were enlisted or you were an officer, our families, your families, anybody who has worn our nation's uniform, your families also sacrificed, and it is our turn today to say thank you to your families, to our military families who are here, because it is their aspect. We also want to empower them with the information to be alongside you all as veterans. On behalf, once again, of our department, our 2 soldiers' homes, and our 2 state cemeteries, I really want to thank you all for being here and being part of this great day and leaving out of here better than what you came in. And I truly believe that. And I truly want to ensure that this community continues to empower one another, because at the end of the day, that is something that we truly have the ability to do. Thank you, Mayor. Thank you to everyone in my distinguished panel that is up here. Enjoy and make this day the very best you can. Thank you so very much, and God bless you all.
Take a wait for you. So we have a Coast Guard veteran who likes to make stuff out of the used cemetery flags, and this is a little piece of history that everybody can take with them that speaks today. So thank you for coming, Francisco.
Thank you.
Take a wait for you. When we sat down and started planning this, we said, well, what's an area that we're having a lot of confusion about when we file claims for Agent Orange? And far and away, the most difficult area that we file claims for is heart-related issues. Under the VA, diseases that fall under, and you can correct me, ischemic heart issues. You know, we were kind of confused as to should we be filing a claim for this veteran or not. There's a lot of them that come through, think they're having heart issues, we should file an Agent Orange claim. So we sat down and we said, we need to get an expert in this, and we'd like to get an expert outside of the VA system, because up here in Franklin County, a lot of our veterans don't use the VA because they don't qualify. So that's one of the things we hope that you can get taken care of today, is getting your questions answered about qualifying for VA health care. You don't need your DD-214 here with you today. There's a lot of VA people here that can set you up, help you file for an application, and if you have existing claims, there's a department here that can check on your existing claims. And again, if you have any questions or anything that comes out of today's presentation that you feel you need more information or you should be filing a claim, we have claims officers here from multiple branches. We have claims officers here from the VVA. We have the VFW claims officer is here. We have my staff. Any one of these people can help you set up an appointment today to file a claim or help you gather information. So with that being said, I'd like to introduce another veteran, a Navy veteran of Desert Storm, who went on to become a cardiologist, Dr. Benjamin Prentice from the Haywood Medical Group.
Well, thank you very much. I'd like to first start off by echoing the sentiment of the politicians that beat me to the microphone here and say it is absolutely a great honor to be here today in front of so many Vietnam veterans and families and people who really know what it is to sacrifice. So it is a pleasure. Thank you very much for having me here. So, as Tim mentioned, I was asked to speak today on ischemic heart disease, ischemic. And when I was asked, I said, sure, this would be great, and I put together this whole big, great PowerPoint presentation, and then on my way here, Tim said, oh, we're not using PowerPoint. I said, okay, well, that's a problem, but I think we can get through this. But I just know that I had plenty of great, pretty pictures to explain things, but I'll have to do it with my hands. So in essence, ischemic heart disease boils down to limited blood flow to certain areas of the heart muscle and the after effects of having limited blood flow. Now, that can take form in many ways. As people know, it can cause heart attacks, but it can also cause angina, exercise-limiting chest pain, which is what angina is. That's related to ischemic heart disease. Now, there is some difference on actually which elements of those will qualify somebody to actually have benefits paid for, but in essence, it's related to blockages of the arteries. And in 2010, and Tim, feel free to correct me if I'm wrong, I think the VA finally said that they will qualify ischemic heart disease as a presumptive cause of coronary artery disease for patients that were exposed to Agent Orange. Now, to be fair, we treat a lot of ischemic heart disease, and if we're all lucky to live long enough, everybody will have some element of it. It basically starts off with cholesterol, fatty streaks developing in the arteries, but it's not just a static process of concrete developing in the arteries and your arteries hardening. It's a process of inflammation and scarring and immune system activation that leads to different processes, different results in different patients. The typical risk factors that we think of, that most of us know, diabetes, smoking, high blood pressure, high cholesterol, all these things contribute to developing ischemic heart disease. And having some plaque in the arteries isn't necessarily the end of the world, but what can be the end of the world is if that plaque becomes unstable, ruptures, and clots off. That's when people have sudden heart attacks, and I'm sure almost everybody in this room knows somebody who was walking, talking, doing fine one day, and dead the next from a sudden heart attack. And it's still the nation's #1 killer, and in fact, it's the #1 killer worldwide, and used to be a malady that we associated with developed nations, but more and more it's becoming second and third world countries are suffering from increasing incidence of heart disease. The ischemic heart disease can take a lot of forms, and it can be difficult to figure out, okay? The coronary arteries are tiny. They're about 4 millimeters at their biggest segments, and then they only taper down from there. They sit deep inside your chest, and they can give people different symptoms. What might be an anginal presentation for one person might be completely different for another person. But in essence, angina, however you like to pronounce it, is pain, pressure, tightness, heaviness, shortness of breath, essentially anything between here and here. If it comes on with exertion and gets better with rest, we would have a very high index of suspicion to think that that's ischemic heart disease. Now, going about diagnosing that can be difficult. There's a lot of modalities that we have to offer, but they're not, none of them are 100%, let's say, short of going for the gold standard, which is a heart catheterization. Now, some of you in the room may have had heart catheterizations before, and there's a few different reasons why you would have had a heart catheterization. If you've suffered a heart attack, a sudden heart attack and been lucky to get to the hospital, I'm sure you went straight to a catheterization laboratory and had that artery opened up. Or if the ischemic heart disease or the blockages of the arteries were too severe, maybe you needed to have bypass surgery. These are both modalities of treating ischemic heart disease, and each one comes about for different reasons. So you people may be familiar with exercise stress testing. It's when they get you on the treadmill and we watch your heart and we have you exercise and see how well can you exercise. But also we're looking for evidence on your EKG, your electrocardiogram, if you have blocked arteries. Now that is, again, not 100% diagnostic. It's not infrequently we can have false positives and false negatives with that type of testing. So often we may use imaging in addition to having somebody exercise on the treadmill, either using echocardiograms, ultrasound pictures of the heart, both before and after you exercise, to make some assessment of how your heart responds to that stress. If you have a tight blockage in an artery and you exercise and that artery doesn't get enough blood flow while you're exercising, well, the heart muscle doesn't work as well in that particular territory. And generally we can get an idea of that with doing just stress testing. Also, there's nuclear stress testing where we take images of the heart both before and after exercise with a similar goal of identifying tight blockages in the arteries. So tight blockages of the arteries is one process of ischemic heart disease. The other part of that is an acute heart attack. Like we talked about before, heart attacks can happen very suddenly, and it's not that you get a blockage in your artery and it just gets tighter and tighter and tighter and tighter and eventually closes off. In the vast majority of times, that's not the case. What happens is you have a blockage of an artery, it may be 30, 40, 50% narrowed, and it suddenly becomes unstable, ruptures and clots off. That's, again, how people have a sudden heart attack. Those type of things we can't, no stress testing can really identify that type of problem because they come on suddenly and the blockage is not severe enough to be picked up by a stress testing modality. So with imaging or without imaging. And so people oftentimes may have a heart attack, and that's when you get treated with a stent or bypass surgery to open up arteries. The only thing that really reduces your risk for heart attacks is controlling the risk factors. All of the other fancy stuff that we can do, stress testing and stents and bypass surgery and all these type of things, they help to restore blood flow to an artery that's not getting adequate blood flow, but it really doesn't reduce your risk for heart attacks. The only thing that reduces the risk is controlling the risk factors. Again, smoking, diabetes, high blood pressure, high cholesterol. There are some other identified risks such as radiation exposure, particularly in the area of the heart, or chronic inflammatory conditions, rheumatoid arthritis, and the like can contribute to developing heart disease because, like I started off saying, it's not a static process of just this really hard plaque developing in the arteries. It's a very dynamic metabolic process, and it's very much inflammatory driven. And I think that while there's not good science on this, that's probably where the Agent Orange exposure may start this process of causing inflammation and an initial injury to the arteries, which then goes on to start plaque development. Again, that's not known, but purely speculative. So again, treatment for ischemic heart disease, stents, bypass surgery, but also I'd be very remiss as a cardiologist if we didn't talk about the other treatments such as diet and exercise, and I'm sure you've all heard that when you've gone to your doctor endlessly. But those truly are things that can make a great difference. Regular exercise, 30 minutes a day for 3 or 4 times a week can substantially reduce your risk for diabetes, high cholesterol, high blood pressure, ischemic heart disease. But also there's been plenty of studies done that show that it helps with mood, sleep, arthritis, cognitive function, brain functioning. So if there ever were a magic pill, it would be regular exercise. So that is imperative in the treatment and particularly the prevention, ideally the prevention of ischemic heart disease would be those lifestyle modifications that we can all use a little bit more of. Also, a word on diet. The science, nutrition science is a very vast topic and ever expanding, and we're learning more and more about it. And certainly an in-depth discussion about dietary measures is well beyond the scope of today's talk, but suffice it to say that everything in moderation. We used to think that cholesterol, dietary cholesterol, and dietary fat were the bad players because it made sense to think, well, geez, if I eat this hamburger that has some cholesterol in it and some fat, that's going to immediately be deposited in my arteries and go down the road of developing ischemic heart disease. Not necessarily the case, and it's been well documented in the nutrition literature that again, fat and dietary cholesterol are not necessarily the bad players. Saturated fat is a bad player, but there are plenty of good fats as well in a lot of the foods that we eat. But the real bad player, particularly in our diets here in the Western Hemisphere, are the refined sugars, the refined carbohydrates that's in all the good stuff, the crackers, the cookies, the chips, the sugary drinks, as has been well documented here over the past 10 years, that are really contributing to the obesity epidemic here in the United States. So, but again, the short story is everything in moderation and try to minimize the dietary concentrated sugars that are available in most foods that are pre-processed. So I think with that being said, there's also medications that I'm sure a lot of you are also familiar with, medications that we treat ischemic heart disease with, cholesterol medications, blood pressure medications, an aspirin. Take 2 aspirin and call me in the morning. That came about, but it's actually true because of the antiplatelet, basically the blood thinning effect of aspirin. And it's one of the oldest drugs that we have available, but it's still one of the most important medications that we use in treating ischemic heart disease. So I think as it would fit for today's discussion, if you have had stents placed in your heart in the past, if you've had bypass surgery, if you've actually had heart attacks, if you've, in some instances, congestive heart failure can also be a result of having prior heart attacks. So if you've had any of these in your past medical history, I think it would certainly behoove you to look into potential VA benefits, particularly as it's relative to Agent Orange exposure. I think that's about all I have. Tim, I don't know how much time we have.
Just a couple minutes for questions and answers.
Sure. Yeah. I'd gladly field any questions.
Yeah, I'm a Vietnam vet, and I have ischemic heart disease from Agent Orange. I had a heart attack about 1.5 years ago. I'm actually doing quite well because I feel a whole lot better, but I'm wondering about the progress. Is there a progressive concern, or will things sort of stabilize? I mean, I'm not looking forward to another heart attack, quite frankly. And I want to enjoy my life as much as possible going forward. And I also really appreciate the help the VA has given me, by the way. So, all right,
Great.
That's it.
Great. Well, thank you for your service.
Yep.
So that's a great question. Is this a progressive disease? Well, yes, in a lot of ways it is progressive, unless, like I mentioned earlier, unless we control the risk factors. It's those out-of-control risk factors that lead toward progressive blockages developing in the arteries, but more worrisome, unstable blockages in the arteries that are more likely to suddenly rupture and clot off and cause an acute heart attack. So again, to answer your question, if you're keeping the risk factors under control, your blood pressure, your cholesterol. You're on good medications to help in that regard, but also getting the regular exercise and paying attention to your dietary intake. That will help stabilize any existing plaque in the arteries and ideally prevent any plaque instability that causes sudden heart attacks. So the good news is, I would say that as long as you do the heavy lifting of keeping the risk factors under control, it shouldn't be progressive in that way.
Yeah, I have a question. I had an ischemic attack this past summer where I just babbled words. Can this ischemic heart disease you're talking about cause that?
Yes, very good question. So a transient ischemic attack is what I think you're talking about, a small stroke. And yes, the relationship between the heart and the brain is very integrated. The same process that affects the coronary arteries, this atherosclerosis, this plaque development in the arteries, the coronary arteries, is a systemic process. So if we see it here in the heart, well, we also know it's going to be coming up here in the vessels that feed your brain, can be in your aorta, can be in the arteries going to the legs and the kidneys. So to answer your question, yes, it's very, very closely related to ischemic heart disease. But this is essentially a similar process, a similar pathology, but going to a different end organ, the brain, as opposed to the heart. But yes, very similar.
Yeah, I want to add, so could you clarify that for me in the sense that when I had this attack, I was just babbling, but it really took me back, and I didn't realize what I had. But do you have to have the ischemic heart disease? Does that have to be just caused by plaque mostly, or not? Because I didn't have any plaque issues.
Yeah, in the vast majority of cases, relative to ischemic heart disease, the vast majority of those cases are plaque-related or unstable plaque-related. Oftentimes with things that go up to the brain and cause a stroke or even a small or transient stroke, sometimes it can be very difficult to identify where that came from. Sometimes it's a little bit of blood clot, frequently from the heart, sometimes from a funny heart rhythm. You can develop blood clots in the heart, and those can go up to the brain and cause these type of episodes, which are, as you know, are quite scary and profound, and thankfully sometimes can recover. So.
Last question, and then if we have any more, we can take them aside later.
I've got a question. I'm Ed Cooley. I was a Vietnam veteran. I had an aneurysm under my heart, and they caught it in time by accident. Would that fall into the same category?
Yes. So aneurysms are they're another broad category of issues that can affect the arteries. So this is not, I'm not sure exactly, was it down here in your abdomen?
Yes.
Yeah. So it's a similar process in that it starts with plaque and injury to the arteries, and then causes a lot of different changes, particularly in that aorta. So it sounds like what the issue you're discussing is what's called an abdominal aortic aneurysm. And those, while it's a similar pathologic process, like I mentioned with the previous question, it's a systemic process. If we see it here, well, we have a good idea that some of it's in the aorta or in the arteries going to the legs or kidneys. So, but it's also affected by a lot of the similar risk factors, diabetes and smoking and high blood pressure and high cholesterol. So, all of those interventions trying to keep your risk factors under control, they benefit all of the vasculature, all of your blood vessels. But yeah, in short, that is a very similar process to ischemic heart disease. Absolutely.
Okay, a good buddy of mine, my husband, they were on the C-123s that they got contaminated with Agent Orange. He has heart blockages and everything, and he's trying to get covered through the VA, but they keep spinning him around in a circle and say it's not part of Agent Orange.
Well, I think
would he
that's,
do?
yeah, our following speakers here may be better able to address that because they deal directly with the VA and the actual benefits and claims. So.
Thank you, Dr. Prentice.
Great, thank you.
Thank you. So like I said, Secretary Urena has another engagement, and Dr. Prentice, being a head cardiologist, he could get up at any minute too. So the next group of speakers that I'd like to introduce are headed by Dr. Rab Cross from the VA Western Mass, Central Mass VA system. So Dr. Cross.
I'm Seth Cooper-Schmid, and I am the Chief of Staff at the VA, and it is a pleasure and an honor to be here. That this is an amazing turnout, that I've been to a number of town halls, and I see well over 200, maybe approaching 250 people here. That is wonderful for an area this size, and it says a lot about your dedication and interest in VA affairs and in what you guys can do for yourselves. I would also like to use this moment to ask you guys to reach out to the other people, younger generation, who may not know about the VA and the benefits that they may be getting, and bring them into us. The VA doesn't always have a great reputation, but as of less than 2 weeks ago, Secretary Shulkin, the new head of the VA, has put the wait time for every VA facility online so you can see how long it would take to get an appointment. And so you can see at the VA Central and Western Massachusetts, we can get you in pretty darn quickly, and we will match Valley Medical Group, Cooley Dickinson, Bay State. We are very competitive. And if you go to any of those other places, they have some of the same snafus that we have. So please use the VA for yourselves, but most of all, help us get in the younger generation so that we can be of service to them. To follow up, I would definitely like to thank Greenfield Community College for the use of the space. But we also have a number of people here who are doing wonderful things. That Mary House from the VA is in the back promoting the hepatitis C treatment that we're doing. That the VA Central and Western Massachusetts has the highest cure rate of its veterans across at least New England, if not the United States, for treatment of hepatitis C, a condition that has been not well recognized until more recently. And now we have really, really good treatment that can be 6 weeks, be 12 weeks by mouth with pills, very simple, straightforward, and curative. That's a tremendous thing that we're doing. But and to follow up on Dr. Prentice, one of you out there was my patient, and I will call you Max Painful to save your identity. But Max came to me a couple of years ago complaining about his angina. And he was on a number of medications, and he had put on a fair amount of weight since retirement. And it's like, Doc, you're not doing anything for me. And he was on all the right stuff. And it's like, well, Max, you got to help yourself. Tell me, come on, what do you eat in a typical day? Well, I have my liter of soda, and then I have a pizza or some fast food. And he spoke about this diet, and it's like, Max, you got to work with me. And Max just scowled at me and sort of would for the first year. And then going into Christmas time 2015, Max didn't show up for his appointment. That's interesting. So, we reschedule him. He shows up a couple of months later, and Max has lost 20 pounds. I was like, Max, what's going on? All of your harping about that soda and the pizza and the fast food and that stuff, I decided to give it a, see if you meant it. So I started eating simple chicken, drinking water, I cut out bread. His ability to walk, which was, he had his angina after a couple of 100 feet. By the following Christmas, he was back to his bowling league. He was 40 pounds lighter. He says, it's miserable being on a diet, doing this, but to be able to do my daily things and to be able to enjoy, it's worth the sacrifice. So, he took matters into his own hands, and it made a big, big difference. So thank you, Dr. Prentice. So we have here Rab Cross, who is our compensation and pension specialist, which is a very important part of the VA, the VBA, and getting in for the benefits. And we also have Brenda Wolf. She works with Rab and with it sort of helps coordinate that whole compensation and pension division and helps our group do a tremendous job there. So it's wonderful to have her here on her day off, putting in extra, working above and beyond. An event like this couldn't happen without a number of dedicated people, which include from the VA, Dennis Ramstein, who's in the back, hiding behind a camera now, and John Paraday, who also has done wonderful advocating for everyone and pulling together events and making sure that you folks are being recognized for the sacrifices that you have made. And so I would like to thank him, and again, would like to ask you to be the recruiters for the new generation to help them get all that they are entitled to and deserve. So thank you very much.
Good afternoon, everybody. I came dressed as Dr. Agent Orange. Thank you. So I'm kind of curious. You don't look that different from me. How many people in this room, Vietnam veterans, are under 60? Very few. How about between 60 and 70? Pretty good number. How about 70 to 80? Even though I'm not a Vietnam veteran, I'm going to raise my hand. Over 80? A few. So it's mostly 60 to 70 and 70 to 80. How many of you are from Franklin County? Pretty good number. Pretty good number. Any of you ever heard from the town of Buckland? Yeah, that's where I grew up. Texas I was at for only a summer. But I'm really pleased to be here today. When I came through Amherst today, there were hundreds, if not thousands, of people on the sidewalks marching into the center of Amherst. They were having the Amherst Sustainability Festival. And I thought of you guys, you Vietnam veterans, you not just guys, but all of you who are VM veterans, because you got sustainability, by God. You're still going. And I congratulate you for that. And at the same time, there is a sadness, because we all know people who did not make it. I'm glad you're all here. And I am going to talk about various conditions that are potentially compensable under the compensation and pension regulations. Some of you may know me. I've done medicine around here for quite a few years, one way or another. And we doctors in some ways are like lawyers. You know, they're specialists. You might go to a lawyer for your finances. You might go because somebody's accusing you of, stealing something. There are various specialists. Well, in medicine, a good many doctors treat people, just like your doctors treat you. But there's another type of physician out there who does what they call forensic medicine. And I think it's important you all understand that the process of compensation and pension involves forensic, objective analysis of people who put in claims, of the information that they submit, of what we find on history and physical when we see them, what we get from documentation from doctors, and how we answer the very specific forms that are put out there for us to report on claimed conditions. So it's a very objective, detailed forensic medicine, And I'm pleased to do it. I have been down at the VA since 2009. And when I went there, I never heard of compensation and pension. What on earth is that? I found out fairly quickly. We have a busy department. We have a lot of claims to deal with, and some good examiners. So I'm pleased to be there, and I'm pleased to be speaking to all of you today. In terms of conditions that are service-connected from the VA, I do want to follow up just a little bit on the cardiac ischemic heart thing, and that really the compensable claims deal with the heart itself, not with the brain, not with the aorta, but primarily with the heart. Does the heart get damaged in any way, and are there problems with it that would disable you from doing things? And if any of that comes your way, by golly, yes, you put in a claim. Claims from Vietnam are kind of divided, and there were two very quick onset conditions that you may have or may not have heard of. One is called peripheral neuropathy, and somebody who's in the service, when they get out, and in Vietnam, exposed to Agent Orange, if within 1 year of leaving active duty, you develop a peripheral neuropathy, that's something to put a claim in for. And if that had been true of any of you, you'd have done that a long time ago. There are a lot of other causes of peripheral neuropathy, and some of which are compensable, but we'll get to that. But just peripheral neuropathy, acute onset, during that year of getting out of Vietnam, getting out of active duty, that's when it was compensable. And if you didn't put in a claim for that and get seen and get diagnosed, it becomes difficult in later years to get a claim in on those. Another one is something called chloracne. And we all know what acne is. Most of us had it when we were kids. But there are some very deforming, disturbing types of acne out there. And one is called chloracne. And I have seen plenty of pictures of it. I'm not sure I've ever actually seen somebody with it. That's another one that occurs within 1 year of leaving active duty service where you have Agent Orange exposure. It's an acute onset thing. So that neuropathy and the chloracne are acute onset. And if any of you follow the news, there was this guy named Yevtushenko. I believe he was from Ukraine. And in London, 2003, 2004, he was poisoned with something that looked like a dioxin-type compound. Man, you ought to see his face after that. You want to talk about chloracne. He was a really good example of that. And I'm certainly hoping that none of you sustained that when you were in Vietnam. So those are the quick onset things after active duty. Then later in life, other conditions can kick in. There are conditions that are related to your blood cells, those little things that go swimming through your blood vessels. And in particular, you don't have to be 50, 60, 70, or 80 years old to get something called Hodgkin's disease or non-Hodgkin's disease. Those are Agent Orange-related presumptive conditions. They have to do with the lymph nodes in your body. Sometimes you can feel a lymph node in your neck when you have a sore throat. Hopefully it goes away. Sometimes you get them in your armpits. They may or may not go away, and if they don't, you sure as heck need to see a doctor and perhaps get one biopsied. And sometimes these lymph nodes, unfortunately, can occur within your body, and you're not aware of it until, man, you get sick. And if that happens and you get to a doctor and you end up with a diagnosis of a lymphoma, you want to get to your VBA folks or whoever you use, VSRs, DVAs, to put in a claim for it, because our presumptive conditions, Hodgkin's and non-Hodgkin's lymphoma. . There are also, even in younger years, problems with peripheral neuropathy again. Okay, but it's a subacute peripheral neuropathy. It's not something that happened within that first year. It creeps up on you when you're in your 20s or 30s or 40s, and you're starting to develop numbness in your arms or your legs or your feet or your toes for no apparent reason. It's not like you're diabetic with neuropathy, you haven't had a stroke, but there's that middle age thing of peripheral neuropathy. If you should have it, if you get diagnosed with it, there's a reason to put in a claim for that, because that is an Agent Orange presumptive. Now, I assume you all know the word presumptive. If you have condition X that's associated with Agent Orange exposure, it is called a presumptive. It is presumed by the military and the federal government and everything that it is related to orange, and you are entitled to put in a claim. And if you have what you're claiming, then you become service-connected and potentially compensated. I hope that makes sense. It only took me 3 years to figure that out. Then when you're in your 50s, and we all remember the 50s, when you're in your 50s, there is, of course, the ischemic heart disease. And Dr. Prentice went over that in good detail. The takeaway from that is, if you have ischemic heart disease, or you think you have ischemic heart disease, pester your doctor about it. And if the answer is yes, or even probably, get the best of doctor's notes and diagnostic tests that you can. Bring them to your VSR, DVA, whoever you're going to see, and submit a claim. Again, you're stuck with us forensic people, and we're going to look at the evidence and either validate it or non-validate it. And if we don't validate it, that doesn't mean we're being mean or bad people, but we're applying our forensic medical techniques to what is provided to us. I should say we get your information provided pretty darn well. You all have to send that in, either electronically or you give it to one of your representatives. They will get it scanned in, or no, they'll fax it in to several locations around the country where they have these poor people that do nothing but scan your paperwork into this big system. It's called VBMS, or Veterans Benefits Management System. And we in Compensation and Pension have access to that. So we can go into that, we can look at your service treatment records. If you've submitted records and documentation from your doctors, we can look at that. And we can then put it all together along with what you tell us and what transpires during our meeting. I hope that makes sense. It took me 4 years to figure that out. Several other things that can kick in. Parkinson's disease, okay? You get a tremor. It may be at rest, or it may be when you go to do something, but you get it and it tends to get worse. And maybe it'll be on both sides, or maybe it'll bother your feet, or it'll give you a face that looks like just a mask without any expression. It's a peculiar disease. It's a neurologic condition. And it is a presumptive under Agent Orange exposure. So you can put in a claim for that, and certainly will get compensated for that, if that's what it is. Now, one of my best buddies, oh God, for at least 10 years, he's had this little tremor of his hands when we drink beer and play cribbage. So I know that it happens. People do get tremors that are not Parkinson's, but Parkinson's tends to progress and get worse. So I hope that makes some sense, and my apologies to my beer-drinking cribbage friend. Diabetes. Everybody's heard of diabetes. Some of you may have it. Diabetes type 2, which means it comes on in later life. I should back up and say, if you had developed diabetes while you're in active duty, then you're automatically service-connected for it. But if you don't develop while you're in active duty, Later on in life, your sugars may go up, your A1Cs may go up, you may not feeling very good, you may be peeing a lot, you may be drinking a lot of fluids, you get to your doctor, he says, oh my gosh, end up on pills. That's a reason to put a claim in. Absolutely. That's a presumptive condition, type 2 diabetes, adult onset. And there are complications of it. It can injure your kidneys. Sometimes it can injure other parts of your body that don't work so well. And then there's the prostate. And I do recognize there are a lot of men out here. Prostate cancer became service-connected. It is a presumptive condition. If you have the diagnosis of prostate cancer, it's made almost always now with a blood test called a PSA, or a prostate-specific antigen. And usually the doctors will get it on us, once we're over 50 or 55, they might do it every 5 years. You get a little older, they might do it a few more times, they may not, it depends. But if your PSA gets high, they're going to scoot you off to a specialist, and very possibly you'll end up with a diagnosis of prostate cancer. That is automatically service-connected, and the amount of benefit that you get is a function of how long your PSA blood test stays elevated, and or how long you are continued to be treated with either oral chemotherapy or radiation therapy. But prostate cancer, if your doctor says you got it, get the documentation and see somebody and put in a claim. There are these funny little things that people get called sarcomas. Sounds like a dance, a sarcoma. Let's do a sarcoma. Well, a sarcoma is a tumor, actually a cancerous thing, that can invade your soft tissues, your tendons, your ligaments. And if it tends to do that and you see something growing on your arm and leg, or somebody says, hey, you got something growing on your back, did you know that? Get it seen, get it looked into. If it turns out to be a sarcoma, a good number of those babies are service-connected. You have to have the pathology report from whoever either removed it or did a biopsy on it and see what happens in terms of treatment. But it's better to get these little lumps looked at and get a diagnosis and find out, is it something related to Agent Orange? And again, your service people, the people that help you put in the claims, can be very helpful on that. And sometimes they will call us and say, I got this guy with blah, 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 and he's got this documentation, should he submit a claim? And we virtually always say, yes, let him submit a claim and see what comes out. Then there are other cancers of the respiratory system, your breathing system, okay? Your trachea, your major airways, your lungs. Most of those are presumptive conditions under Agent Orange, but you got to pull out cancer from asbestos. Asbestosis does not fall into it. That's a different kettle of fish, totally. But in terms of the lung cancers, again, you will have been diagnosed, whether it's somebody at the VA, somebody elsewhere, somebody in a specialty area like Springfield, Northampton, Boston, Worcester. Get the information, get the pathology reports if you can, get the doctor's notes, and get some help submitting your claim, because that is a presumptive. So I hope that makes sense. I wanted to go through these. There are other conditions out there that the Institute of Medicine is still drumming their fingers on, trying to decide, are these things going to become service-connected? Are your thyroid conditions going to become service-connected? They haven't gotten there yet. They're supposed to have made a ruling on that a year ago, and now I don't know quite what they're going to do. There's another strange type of thing It's a cancer. It's service-connected. It's called cholangiocarcinoma. Woo. And what it means is a cancer involving the little ducts in your gallbladder, in your bile system. It's not immediately evident unless you turn yellow, as with jaundice, or you start itching a lot, and you get to see a doctor, and they'll help you make a claim, a diagnosis. And if you get a diagnosis, I don't know how many times I'm going to see this, get the information, get the notes from the doctor, get the pathology reports, get the scanning reports, and get it to someone to help you submit a claim. I think that's probably it for me. I should say that as far as children go, spina bifida, the condition that affects the spine, usually right down around the butt, but sometimes in other areas, it tends to leave it kind of open, not closed. And it has to be taken care of. It's not a cancer, but it is a very bothersome thing that can continue sometimes for all of life. The VA won't examine children. We don't bring them in. But if you get documentation about your child having spina bifida in particular, you want to submit that and try a claim. It may be denied because it's not, as of yet, depending on what the condition is, service-connected, but you certainly want to put it in. I believe that children from Vietnam who have spina bifida are covered, but you have to get the diagnosis in and put in a claim. And I think with that, I probably have said enough. I want you to know that I really had a good time at the VA. I was never in Vietnam. I was never in the military. I had surgery on my knee when I was a senior in high school. When I got drafted in '68, I had to go to the Boston Army base. What a zoo that was. Man. But they looked at my knee, they looked at my surgery report, and they said, "You're out of here 4F." So that was the end of that. So I've never been in the military, and I don't much like authority. And I've had a ball at the VA in Leeds. I really have. The employees are nice. They're so much fun. The veterans are good. I see a number of you. Often I've been in your town. I've played baseball or fast-pitch softball there. I've had, a meal, had a cold beer there, whatever. But I know most of the towns in Western Mass, having grown up in Buckland. I'm proud of you all. I thank you.
Dr. Cross,
Sir.
you would take this just as a little memento for helping out.
Thank you. I will. Thank you.
Is anybody else from the VA team going to speak?
So we're going to, we'll wait for question and answers.
Okay.
We'll be a little bit.
So out there on the tables we got from the VVA, Dr. Cross referred to, just a few of those presumptive issues. Out there on the tables, you see we ran a couple hundred copies of this little pamphlet here. It's called Service-Connected Disability Compensation for Exposure to Agent Orange. Please make sure you've got one of these. If you don't, we'll get your name and address and mail you one. If you look at like the third page, there's over 40 diseases that are listed here that are associated with Agent Orange. Okay? It might not just be the main diseases that are shown by the VA. There's all these secondaries. And it also lists the diseases for the male veteran's offspring and the female veteran's offspring. So please, make sure you don't leave here today without one of these, or at least we've got your address and we'll mail you one. So next we have from the Veterans Benefit Administration. That's the branch of the VA not related to the health care, and he'll speak about some of the issues and situations and the process there. Why don't you come on up, Curtis? Thank you.
Good afternoon, everybody. All right, so driving out here today from Boston, and I'm a Navy veteran, originally from Chicago. I was driving and I was thinking to myself, I understand now why when people travel from out here and they finally do come to Boston, if you don't make sure they're happy when they leave Boston, That's why they want to slap you around, because that's a long trip, okay? On top of that, I recognize too that winters must be serious up here with one road. Most of that's just one road. And I was like, wow. Anyway, ladies and gentlemen, it's an absolute pleasure for me to be here today. A couple of things I'd like to start with when I come out to be invited to speak here is to establish who I am so we know what we're doing next. Number one, I did 21 years of active duty for the United States Navy. I just hit my 30-year mark, or I will be in the next couple months. Now, I'm not as handsome or as sexy as most of you, but I'm trying, okay? Next, I'm a disabled veteran, so I'm the people that I serve. Now, although all of us may or may not have the same things, my job is to take care of you because I understand that I am you. So I don't come out here on Saturdays or Sundays just to be here and look cute. I'm out here to work for you, and if I can help you, that's what I'm here for, and 2 other people from my staff are down the hall. So if you have questions or you're concerned about something, please stop by at the minimum. What would it hurt to ask? That's why we're here. Last, I'm at the regional office in Boston, and that doesn't mean that we don't want to come out to Central Western Mass to help you guys out. And we right now in the process working with the people in Worcester and Northampton to try to get a electronic process in place. So if we can't make it all the way out here and you surely can't make it all the way there, if you can get to Worcester, COBC, Northampton Hospital, you can sit right at a camera and you're gonna see me just the way I'm looking at you, and the only difference is we won't be able to touch each other, but we'll be able to have the same conversations, kind of like if any of you guys ever had a video conference and you had to do it at an alternate location. Bottom line is, get in front of somebody. A judge is a judge, a rep is a rep, but I come from a generation where you talked to people, you shook their hands, and you gave them your word when you was gonna do something, that's what you did. So if I'm talking to you and we see each other, sometimes that's what it is. You want to know a person hears you, wants to help you, and you just need them to know what you're asking for. And it's difficulty sometimes when you call in the 800 number, or you mailing stuff in, or you gave it to somebody and you don't know if they got it or not, or if it got to us or not. So it's a couple of things I want to tell you guys to be really helpful to you today. Number one, show of hands. How many of you have received letters from the VA, and before you raise your hand, looked at that letter, did not see what you want on the first couple of pages, and threw it away? Okay, not that many, and some people just not raising their hands, and that's fine. Next, if you didn't read those, you made it very difficult for anyone like myself to help you. Because in the next couple of pages, I can guarantee you it was probably something there that if you had read it and it said evidence considered, places you've been, if you looked there and did not see everything that you thought you turned in, that's the first thing you're supposed to tell us. Well, listen, I know for a fact I lived out in California for 2 years. I went to the hospital system in California. How come you guys don't have those records? I didn't see it in the evidence considered. See, before somebody send you straight to an appeal, which is taking anywhere between 18 to 24 months to be heard, why wouldn't you rather get a reconsideration? Let me say that again. If you get a decision and you immediately look at it and you think it's something wrong, or you don't understand why you didn't get what you were asking for, you need to look at the 3rd page, because that tells you everything the VA used to make that decision on your claim. If you don't look at that, or you don't have somebody who's versed in that to explain it to you, you probably just put yourself in a situation where you're angry, aggravated, and you think that nobody really want to help you. They just cutting you off and just telling you no. And I can't tell you how many times I've heard people say they just waiting on us to die. Listen, I had uncles in Vietnam, Korea, grandfather was in World War II. So I come from a lineage of military people. So it's a pleasure to keep doing this. After I took off the uniform, I keep working to take care of people who wore the uniform. So here's a couple things I want to tell you today, and this has nothing to do with how old you are, what you filed, what you didn't file. It has to do with the fact that as long as you're able to ask questions, file claims, you should get the information from the people to do that. Number one, show of hands, how many of you have veteran service officers, town agents, or anybody that you know that can help you with claims if you have no computer access or don't know how to use them at all. Okay, why is that important to you? Because those folks are the ones who make sure that they get things to us and they speak our language, which means they know how to help you file these claims when you can't get to Boston or you can't get to the hospital. It's really important that you try to identify who these folks are, because it's a lot easier for you to drive right down the street 15 minutes than it is for you to drive 2 hours and 20 minutes to come to Boston and still not know for sure what's going to happen today. Second, e-benefits. That is a place where you can go, sign up for your own account, your personal account, and you can track anything, look at anything that you're doing with a claim. And there's so many other benefits that you're entitled to as a veteran that's in there. Simple things like you guys, most of you have property of some kind. You own a boat, you own a house, and each year that property tax means a lot to you because it's going to give you a break on your taxes. Am I correct? What happens if the system that generates those letters to send them out, all of them don't come to Western Mass this year? You panic and you start calling the 800 number and calling whoever you can to try to get that letter. You had this e-benefits account. You can go in there and print that letter off yourself. Well, I don't have a computer. Somebody you know have a computer. You have grandchildren, nieces, nephews, and most of them still like you because you gave them candy and stuff when you was uncle or aunt, whoever. And even if you decided that you don't really like them, use them anyway. They used you. Point I'm making, ladies and gentlemen, is there is a way, and if it's not somebody who really care about what your service is and what you've done, they're willing to help you. Now, this is important because it's so much nicer for you having a cappuccino or a cold beer to go in and look and see what's going on. Why is this important? Because if you do need to call the 800 number, you know what you want to talk about, you know the questions you want to ask, and you can say, on this day at this time, I submitted this claim. It's been 30 days and I haven't heard anything, and I see that the status hasn't changed. Can you provide me with an update? That's so much better than this. What are you guys doing with my claim? When did you put in the claim? A couple months ago. For what? I don't remember. You should know that. I called you. You should know what's happening with me. It's not that easy. If it was, everybody'd have a claim in and they wouldn't even have to check on it. So what I'm saying is, have your information as best you can so you can push it to the next person. We have 3 forms that everybody in this room at one point or another may need to use, and they're in this order. VA Form 21526EZ. That's the claim that everybody will use to put in a claim, period. No alternate forms, nothing extra. But the difference between the old system and the claims that we use now is each time you file a new condition, you have to fill out one of those claims, because it's a quicker process with the claims if we know, because before you put a claim in January, forget about your right toe, you put that in March, then you put something in April, and what used to happen is every time we got that information, we'd slow up the first 2 claims until we got everything from the last one. And now, if you have a claim in for hearing loss, we're gonna try to get that process through and get it finished. And if you get the next one in, we're gonna work on that one going forward, so we're not trying to put them all together so you guys can, and you're sitting around waiting 6, 7, 8 months and you don't have a claim or anything that's answered. What we want to do is get you an answer or a decision as soon as we can and get you something. And then we will work on the rest. But under no circumstances should you think, well, should I put one in or shouldn't I? Have a service officer. When you call, ask questions. When we come out to talk to you, take advantage to ask if you have a question, because we want to take care of you, and that's the easiest way to do it. Next, if you're filing for pension, which is an age and a income-related benefit, not to be confused with service connection, is simply because you're 65 years of age or older, 90 days of service, 1 day wartime, and you have an honorable discharge, and you just need a little extra cash, or you just decide you wanted to file to see if you qualify for the pension. The pension is income-based, so if some of you guys sitting out here and you got a net worth of $250,000, I wouldn't waste time filing for pension because you're not going to get it, okay? It is for someone who really has a condition that's developed over time and you just want to file for it simply because you're a veteran. And then the 21534EZ, that's if you're filing for benefits associated with someone passing away and you're a widow or a child of a veteran who passed away, and you want to make sure that you see what you're entitled to. So you would put that one in, and that one would talk to you about deceased benefits, burial benefits, anything else that goes along with that that's associated with it. So if you're in a situation like that, and a lot of you guys have stuff just like I did, you got it tucked away somewhere, nobody knows where it is. Listen carefully to me. The people who are going to be responsible for taking care of those things for you after the fact want to do the best they can to get you any honors, any entitlements, any services that a town, the state will offer you as a veteran. But if they can't find that box that have all your paperwork in it, we can't do much to help them. And if they need that like right away, because the burial happening next weekend, I don't think you can get a 214 that fast unless you come into a regional office and ask for it. And even then, some of you guys didn't start out here. You joined someplace else. And if it's not in the state of Massachusetts, it's going to take us time to find it. So as much as you can, try to provide your folks or your families with the documents that they need to at least walk in the door and say, listen, my grandfather, my dad, my mom passed away. They were active military once upon a time. What are they entitled to in the state? What are they entitled to with the federal government? You want to make sure that you make it easy for them to take care of you, because a lot of places will offer you the honor guard. They'll offer you state burial benefits. They'll offer you, if you want to be buried at a place where it's just for military folks, or the state cemetery, or down in Bourne, Mass at the National Cemetery. You have to have paperwork to do that. So if you got that someplace tucked away and nobody knows where it is, dig it out and tell them, in the event something happens, this is what you'd need. Last but not least, we want to make absolutely sure that if it's something we can do for you guys before we leave this beautiful town of Greenfield today, come by and see us. If not, get some information for us and we'll get in contact with you. We'll do the questions and answers when I'm done, but the main reason, again, that we out here today is to make sure you guys know that we understand it's not always easy for you to talk to people or talk to VBA people or hospital people or a combination of them all in one place. So that's what we're trying to do today on this panel, get together and change the culture of VHA being over here and VBA being over here. We working together now and doing a lot more of this outreach and a lot more of these events so we can try to give you guys a one-stop shopping experience versus you go to the hospital, they have no idea what we do. You come to us, we try to send you back to the hospital. Not that we know everything the hospital does or they know everything we do, but we generally versed in each other's business so we know who to send you to next. And you don't feel like you're getting a runaround. Other than that, I'm gonna put this hand up, this one. I'm gonna give y'all a round of applause.
So I want to echo what Curtis said. I mean, we have at least once a week here doing the 26 towns of Franklin County, and even we help people come across from Vermont, New Hampshire. Dad died. I want to get him a footstone. Okay, where's his discharge? Don't know. Never seen one. He come from Colorado. So please, like echoing what he said, can you make sure your family has a copy of your discharge as a minimum? Okay? Don't leave them in the lurch when you leave, because you create a lot of heartache for your loved ones if you're not keeping them in the loop. So don't be a stubborn Yankee. Next person I'd like to introduce before we get to the question and answers is Rick Weedman from VVA. He's their head legislative person down in D.C., and we invited him up here today to give us an update on some of the latest that's happening down in Washington.
Thanks, Jim. First of all, it's great to
It's great to be with y'all. When Bill Martin and I first met each other, my home was in northern Vermont, and it's not an accident that VVA chapter number 1 is in Rutland. So this area of the country was one of the first areas that we set out to help organize. And Bill, who is now mayor of this town, was on our original board of directors and was an important national leader at that time, and then moved on to do things here and became a nurse, etc., and provide the kind of leadership we needed in the VA as well as civically here in Western Massachusetts. So it's a real honor for me to be back with Bill Martin. I work in Washington, but nobody elected me to nothing. And I work for the officers and board of Vietnam Veterans of America and for the state councils, including the Massachusetts State Council and the chapters. And we are very much a grassroots-driven organization on everything. We organized, beginning in 1979, on really 3 issues. Number 1 was Agent Orange, which we were told was a communist plot to discredit America. Number 2, PTSD. They said it's all in your head. It's, you guys are a bunch of whiny Vietnam vets. It's not for real. And of course, it was for real. It was for real for every generation going back to the millennium for those who experienced combat. And thirdly was judicial review. We put our lives and limb on the line in defense of the U.S. Constitution. Not a particular government, not a particular policy, not a particular war, but in defense of the Constitution. And in that Constitution, there are 3 separate but equal branches of government: the Congress, the executive branch, and the judicial branch. Everybody has access to the courts, including illegal aliens, except veterans. And this in loco parentis system that was put together to basically patronize those who had borne the battle is simply unacceptable. It never was acceptable in my view, but it certainly is unacceptable in the 21st century. And it's time that we change that. And it is changing simply because we rejected a lot of the stuff that our father's generation accepted. And that's how the vet centers came about. And that's how getting out into the community came about. And that's how veteran-centric models of organizing the VA and culture came about. It's because of Vietnam vets, but the Gulf War vets and the OIF, OEF veterans behind us, essentially our children and our grandchildren, are changing that culture further. That they're not accepting, God, we've always done it that way. Well, why? Why did you always do it that way? The benefit system is a total scandal. And it all revolves about to one thing. And that is, there is no mechanism within VA to have binding precedent. The Court of Veterans Appeals can rule in a 5-judge panel on Monday on a certain issue. And at the end of next week, an individual judge on the Court of Veterans Appeals can rule exactly the opposite, and there's nothing to stop them. This is nuts. The Veterans Benefits System is ultimately a system of laws and regulations that were promulgated pursuant to law. And it's a right. It's not a something noblesse oblige that somebody hands you because you're a poor old sad sack. We used to argue with Sonny Montgomery, who I, as an individual, loved, but we argued like the Dickens with him, with PTSD and Agent Orange and on judicial review. And he said, look, you guys, you boys, if you got some poor old vet shot in the butt, you bring him to me and I'll make sure he gets took care of. And we said, Mr. Chairman, that's not the point. It's not who you know. It's what he did. What he did when it was hard to do. And that's the reason why he or she has this right that they're due, because they were harmed by virtue of military service. When it comes to, this sounds like I'm getting off on a philosophic, I'm not at all. One of the hottest issues going on in Washington now is the issue of the appeal system is totally broke. And I agree with them, it is broke. But it's broke because there is no way to set binding precedent. And instead, what they want to do, instead of correcting all the problems, is they want to continue going too fast through the icebergs and rearrange the deck chairs on the Titanic and think somehow they've solved the problem. It's crazy. We have, last fall, all of the other major veterans organizations, the big six, of which VVA is one, but also another 12 organizations, all came out in favor of this bill called the Modernization Act. And we were the only ones who weren't in favor of it. And so finally it came to a showdown, and the then Deputy Secretary is a decent enough guy, and Sloan got me to give my word that we wouldn't actively oppose it because it was the end of the Congress, and if they didn't get that through, they wouldn't get anything through. Well, he's gone. It's a new administration, it's a brand new Congress, and people said, but you promised. I said, I promised too. Sloan's gone. He's retiring and he's down in Hilton Head golfing. So all bets are off when it comes to that, and our board said, no, we're not going to go along with this, and we're going to continue to push that we need real binding precedent and judicial review so that when a decision is made, you can then automate it and it holds right across the board. Because now you have the VA adjudicating 100,000 claims 100,000 times. You adjudicate it, and if it goes up on appeal and you set the precedent, then you change the rules on the machine and you run it through. It is absolutely inexcusable. This is what the private sector does. It's absolutely unconscionable that the appeals are lagging the way in which they are, one, and two, that the decisions made on the same claim by different clerks in the same office comes out different. That's crazy. That is arbitrary. It is capricious and therefore not constitutional. And so this appeals thing, you'll be hearing a great deal more about it, and among of which one piece of legislation that we're backing is called the Veterans Civil Rights Act, basically restoring your right to seek redress in the courts. If anybody deserves that, veterans do. So, having said all that, that has to do with claim no matter what it's for. When it comes to Agent Orange, and I say toxic exposures, because frankly, it is the same people who are withholding information on Agent Orange that are withholding information on Gulf War exposures, that are withholding information about the burn pits, who withheld information from the atomic vets, et cetera, et cetera, et cetera. It is the same small unit in VA called Environmental Hazards and Public Health, and it is the same small unit in DOD. Among other things, we've called on the Secretary of the VA and on the Secretary of Defense, Secretary of VA to press and the case with the SecDef to lift and declassify all of the records having to do with toxic exposures. They said, we can't do that, that's secret. Really? The bad guys have this stuff. How do we know that? We gave it to them. We taught them how to use it. The only people who were denied the information are the veterans and the American public. And at one point in one of the suits we brought in the last 15 years, DOD attorney gets up and says, they're right, they were exposed, but they know they were exposed, so it's okay if we deny it. And everybody sort of, what did he say? And the judge was astonished, and she looked at him, and this is in Federal District Court in Washington, and said, "Excuse me, counselor, could you say that again?" And he said, "Well, they know they've been exposed, so it's okay that we deny it." And she said, "That is absolutely absurd. Why in the world would you not tell the truth, which you are bound to do before this court, even though you're the government lawyer?" And he said it again, that because the vets know they were exposed, it's okay if we don't tell the truth. Well, the problem is, if the government doesn't tell the truth and they withhold evidence, the veteran doesn't get the claim through. We didn't win that case, even though we won in matter of law and matter of fact. They still found in favor of the government. And sometimes you win and sometimes you lose, so we turn back to legislation. And we have champions on both sides of the aisle on this key issue of toxic exposures. We are determined that the young people who served in the latest wars don't find themselves, they and their families, in the same position we are 40 to 50 years after they served. There's no reason for that to happen. And so that's why the bill we got through last year, focusing on children and grandchildren, was called the Toxic Exposure Research Act. Not just Agent Orange, but that includes Lejeune, that includes radiation exposures, that includes shipboard hazards and defense and decontamination program. Whatever toxic exposure people were exposed to in the military is lumped into that. There was a lady who personally I like. I think she's a lovely person, and she retired, but her last major deal was last year convinced the Senate committee that it was unreasonable for them to leave the bill intact because she said there's no such thing as male-mediated birth defects. And we said, yes, there is. There's plenty of published, peer-reviewed literature on this issue. But the Senate committee got spooked, and they made the bill focus on a study to find out whether or not male-mediated birth defects are biologically plausible. So that's what the current committee that was impaneled pursuant to that statute is focusing on. So we are spending a good deal of time now on our staff compiling every peer-reviewed study we can find, and even some that aren't peer-reviewed, that was published anywhere in the world in regard to male-mediated birth defects. They're not arguing that women who served in Vietnam, that their children and possibly grandchildren may in fact have inherited birth defects because of a change. But we believe it is possible, and people whom we talk to who are respected scientists say, yes, it is. It doesn't alter the gene. It's called epigenetics. What it does is change the acids that serve as a trigger to other acids, which triggers certain traits on a gene. So that you have kids who are 4 and 5 years old having heart attacks or having lung cancer and nobody in the household smokes. It's things like that, the anomalies. There's just too many of them, not just among our children and our grandchildren, meaning Vietnam vets, but frankly, the Gulf War vets. There are several, we work pretty closely. They don't have their own organization, unfortunately, but they do have leaders who we work with pretty regularly, and they do have support groups of the young women who have, I know one that has 3 kids that all have birth defects. And she was directly in line with what was called the cloud from Kamitsiya, and Kamitsiya was a chemical weapons dump that the Iraqis had that special forces blew up. So this particular panel is going to be absolutely essential that we win on this one and that we get the recommendation positive from the IOM on this question. And once that's done, then we can start to loose the dam, if you will, about enough research dollars going into specific kinds of birth defects and how possibly can we mediate or remediate the damage that has been done by the original toxic exposure. The second bill that we had planned to introduce last year, but it just, I don't know why we thought we could do two major pieces in the same Congress, but we did. The other one is called the Toxic Wounds Registries Act. And it's more directed towards the veterans as opposed to progeny. In other words, not towards the kids and the grandkids, but it's about whatever condition the vet, him or herself has. And forcing the VA to do real registries. How many people here ever took an Agent Orange physical at VA? Anybody? I did. You know what that is? That ain't a registry. That's a mailing list. They have no idea, if you looked at my name on the list, how I'm doing, because it's not keyed to my electronic health care record. The only registry they have at VA is the Hepatitis C registry. And why is that? Because we argued up and down and sideways and got our way, thanks to Dr. Lawrence Deaton, who was head of that at the time, that section, that it is on hepatitis C, they can tell you what's happened to each person who's tested positive. And if they're being treated, and what's the course of the disease, and now, of course, you have what is tantamount to a cure. Before, you only had treatment, and frankly, the treatment was worse than the disease in some cases. We need to do that for Agent Orange. We need to do that for people who served at Camp Lejeune. And frankly, we believe we need to do that for people who served any place where there may have been a toxin. If you look at World War II, through Korea, through the atomic vets, through Vietnam, through Gulf War I, and through both Afghanistan and Iraqi war, what is the real common denominator that was used in every single theater? And the answer to that is pesticides. At the submolecular level, I know this sounds stupid that I'm talking about this stuff, but it's important because at the submolecular level, which in fact what is impacting on the epigenetics, it works the same as dioxin. It meaning organic phosphates. And that's the basis of, it was the basis of DDT, and then malathion, and then this on, right down to the present day, wherever the U.S. troops in rough places, they're using pesticide all over the place. And I might add, Monsanto just got them to okay a pesticide that's going to be used on U.S. farms, along with 2,4-D, which Monsanto claims is harmless. You may know there's two main elements in Agent Orange, 2,4-D and 2,4,5-T. They say, well, there's no 2,4,5-T and 2,4-D is harmless, but it's not harmless. They claim it is, but they're not forced to prove it. And so what is happening to our grandkids? It may well be that we've passed on a genetic weakness, if you will, because of our exposure to poisons in Vietnam or elsewhere in the world while we were in military service. But that's now exacerbated because it's getting into what they eat and what they drink. So it's appropriate that this gathering today is on Earth Day. because it is connected. If we're going to sustain life in these United States of America, we've got to stop befouling our nest. The old crass saying is, don't poop where you eat. Well, we've been pooping where we eat in this country, and we need to stop it. So that's a larger question, but in the meantime, what we need you to do is to write your congressman, to write your senator, and just push hard on toxic exposures. And through Gumersindo, where's Gumersindo? He's here somewhere. But through Gumersindo or any of the VVA folks, they can give you the heads up about what bills are pending, or if you go to the VVA website. This booklet is enormously valuable, and we know it is. It's the one we can't keep in print, no matter how many tens of thousands, 20s of thousands we print of it, because it is so valuable that people all want it. But it is available if you didn't get a clean copy today. If you go to vva.org, or if you just Google VVA Self-Help Guide for Service-Connected Disability Compensation for Exposure to Agent Orange, or just Agent Orange Self-Help Guide, will probably get you to the link where you can print it out at home, or your grandchild can print it out. There was a genetic change somewhere around 1983, 85, and these kids, they have the gene for doing all this stuff with electronics. I have to struggle like hell, and usually say, I can't make the remote work. I need a 14-year-old. You know, my kids are now grown and out of the house, so go get one of the neighborhood kids to help me program the darn thing. It will continue to be a battle on toxic exposures. It is a battle we cannot lose, because it impacts on not just our children and grandchildren, but the children and grandchildren of the current generation. We've got to have a mechanism to start to straighten this out so that you have registries in the beginning. People were talking earlier about what's service-connected and what's not. The diabetes rate is more than double for those of us who served in country versus those who served in continental United States. In epidemiological terms, this kind of thing never happens. I mean, they deal with tenths of percent as significant variation, but double plus, and for prostate cancer, it's almost triple. This is astonishing stuff. And we believe that the case that we've made to the IOM, that the Institute of Medicine, now called the National Academy of Medicine, in regard to an additional 5 conditions, don't even begin to cover it. But this secretary needs to do what's right, stop listening to the green eye shade people. And nobody said, hey, we can't afford any more supportive fire from the New Jersey and I-Corps, so you can't do it. My point is, if you can take us to war on a credit card, by God, you can use that same credit card to take care of the men and women who fought that war and their families. Thank you.
That was fantastic. Thank you very much. Thank you. There's something to take home. Thank you. So before we get to the final question and answer period here, I have one last speaker who'd like to come up and talk about her experience with her veteran husband from Vietnam. And then when she's done, we'll turn the floor over for questions and answers with the VA staff. And they'll answer any questions that we can get done today. And again, before you leave here today, either make sure you've got some contact numbers from my staff or the VA staff or from the VBA, you know, so that we can continue to get answers. The idea here today was to just give you a kind of a shotgun blast of information so that now you know at least where you can turn to get more information. And if you can't find the answers with the hundreds of years of experience out here, God, I don't know where we can get the answer for you. So please, don't leave if you have questions and not contacting one of us.
Don't leave yet.
So Dee Brooks would like to talk for a couple minutes.
I'm so pleased to be here today in regard to speaking about my personal experiences in dealing with the VA, DIC, and CHAMP VA. And I hope that I can help many of you navigate the system, both husbands and wives. I was married to my husband, Corporal David Brooks, for 35 years before small cell cancer took his life. He was also diagnosed with heart disease and prostate cancer. He served in Vietnam between 1966 and 1967. He was a Marine who served proudly with the 3rd Marine Division, and his unit was stationed nearby the DMZ. One critical medical issue that happened to him in Nam is when he began having serious rashes on his skin. It was so bad that they had to medevac him to a ship for treatment. He was on board for 3 to 4 weeks. He did get better, but the doctors could not find what was wrong with him. However, a few years down the road, he began to get the rashes again, and it was presumptive when the VA said it might be chloracne. In 1978, the news came out about Agent Orange and PTSD. He was concerned as I was pregnant with our first child. For the first time, things about his deployment to Vietnam began to make sense to him. He remembered that he was told to drop to the ground anytime he saw the chopper spraying. And so, what happened then is that he remembered it. I do have to add this, was when he was having his dreams, it's when he woke me up and told me about it that he remembered it. Now, and also remember that this remembrance of his time in Nam happened 12 years later. Now, during the 1980s, Dave went to the VA hospital in Leeds, Mass, to the in-house treatment at the PTSD clinic. He learned a lot there. He was so grateful that he attended. He finally understood why he was feeling the way he did. He not only helped himself, but it saved our marriage. As a result, for nearly 15 years, he attended there for a 2-weeker. Why? Well, that was the time of an anniversary battle when he served in Nam. In the late 1990s, Dave became 100% permanent total for health problems incurred by his service. He began to go to the VA for medical issues that came up. As a result of his rating, he became eligible for treatment at the VA. And I can say, in all honesty, that the care we both received there was wonderful. Why? Because during that time, if you were 100% permanent total, your spouse could receive treatment at the VA. And treatment I got. And now the VA really tried to help him in other ways than the chemo. And also, the VA was wonderful. Unfortunately, on October 5th, in the year 2013, he lost his battle with the disease. He fought for 2 years with grace, dignity, and humor until the very end. After his death, I continued to receive excellent care at the VA. Unfortunately, in February of this year, my medical care at the VA ended. Why? Because in February of this year, I turned 65. So now I have Medicare, but I also have to tell you that the VA is giving me secondary insurance known as CHAMP VA. And I am so, so grateful for this. Now, because of his service and because of his 100% total for his disability, I received DIC. And what is DIC? DIC means dependency and indemnity compensation, and it's a tax-free monetary benefit paid to eligible survivors of military service members who died in the line of duty or eligible survivors of veterans whose deaths had resulted from a service-related injury or disease. In closing, I would like to offer a message to you and your loved ones, to veterans. I know that many of you say, I'm fine, or someone is worse than me. But please remember this. When you enlisted and raised your right hand, you promised to serve your country and serve it well. But in doing that, the government also promised to take care of you. So please, take advantage of all the VA can offer you. And veterans, I also must add this. Please include your wife or significant other. When my husband was diagnosed with the cancer, we went up to White River Junction, great hospital, and I took a notebook with me. And my husband asked me, Dee, why are you doing this? I said, so I can take notes. Okay, he said. So we saw the chief of oncology, and one of the first things he said, oh, Mrs. Brooks, you've got your notebook. Great. So please, please include them. The last thing I want to talk about is I'm going to ask you, if you need to, please come to the Upper Pioneer Veterans Office on Main Street. I volunteer there. I volunteer there helping veterans of all eras in finding jobs. I also counsel widows and also help them find jobs. So if you're in that category, please come. You can also come here to see what you are entitled to, with assistance in finding a job, or just connecting with others in the same boat. I also encourage you to come up to me after this program to ask any questions that you need to have answered. I thank you for your service. I thank you for your families, because my son served, and he was in the Marines and had 2 tours in Iraq and 1 in Afghanistan. And I come from a military family, and I'm just telling you, thank you so, so much.
I'll get you yours before you leave. Thank you. So now we'd like to have the VA come up.
There's one more piece when it comes to the nuts and bolts. We talked about conditions, we've talked about getting your evidence, we've talked about submitting claims, that it unfortunately takes a while to get your claim reviewed by somebody, and then ultimately, they're going to send in this little thing called a 2507, which is a request for an evaluation of a veteran with a claimed condition. And those requests fall to Brenda and the staff in compensation and pension. And Brenda might have a couple of things to say about it.
As part of an effort of trying to help VBA and work as a team, like Curtis said, part of the biggest issue is being able to read the letters that are sent to you guys. These letters are very important. They tell a lot of information. One of the letters that are sent to all of you guys is where we come in. It tells you guys that your closest VA is going to be scheduling an appointment to you. Sometimes this isn't always the VA. We do work with contract outsiders. Either way, that's us telling you you're going to have your exam. Not all exams that have been requested or claimed will get an appointment, just the ones that they need help with additional information. On those, if you receive your letter, you can feel free to go ahead and call your local VAs. If we don't have the request for you, we will try to help you find the VA that does. Also, part of the thing is it's very, very important that you all will know that with your appointments, they are all negotiated. So we will work with you per your schedule and your availability, also with ours. So please, whatever you do, when you get these letters or the information, either from the VA in part of your claim or from the VBA to just update you as to where you are, please open everything and read the information. It is very, very important. Thank you.